Good afternoon, everyone. Welcome to the second in our Placelta webinars. In this webinar, we'll be discussing some recent clinical studies of amniotic membrane and umbilical cord serum. And we've highlighted these studies in our latest ophthalmology newsletter. And all of these studies are available on PubMed. You can get access to the full study, the full paper, and they're all free of charge. Okay. So what we'll be doing today is going through a number of articles, the section on the expanding ophthalmic indications for the use of amniotic membranes. There's been a couple of papers on the use of amniotic membrane for pterygium treatment and for the reduction of pterygium recurrence. We'll be discussing a very good review, a comprehensive review of umbilical cord serum for the treatment of ocular diseases, and a very interesting paper that looked at the use of umbilical cord serum in patients with glaucoma. And then at the end, we'll have a opportunity for everyone to ask questions. So the first papers are relevant to our Amniomatrix product. We have a cryopreserved Amniomatrix product as well as a dehydrated Amniomatrix product. And there's been two reviews of long-term use of amniotic membrane, and these have come from specialist eye centers, both of them based in Europe. The first was a paper by Paolin et al. Entitled Amniotic Membranes in Ophthalmology, Long-Term Data on Transplantation Outcomes. That was published in 2016. And then Rock et al. Published a paper called Amniotic Membrane Transplantation in Reconstructive and Regenerative Ophthalmology, and that was published in the Annals of Transplantation in 2018. So the first study by Paolin et al. Was a study conducted by the Tissue Bank Foundation of Treviso in association with the Veneto Eye Bank Foundation. And this study looked at their distribution of 5,349 amniotic membranes over 12 years from 2003 to 2014. And just one thing to highlight was that this tissue bank was cryopreserving all the membranes. So all the membranes in this study were cryopreserved. And on the right-hand side of this figure on table 2, we can see the distribution and the pathological conditions treated during the period of 12 years, 2003 to 2014. And it's quite a comprehensive table. Some of the key points to take away from this study were that it's a very safe treatment. There were no adverse events reported over 12 years. And they did have a very good table here showing the success rates for the various ocular therapies. So you can see that for quite a few, there's 100% success, including corneal ulcers, recovery post-keratoplasty, glaucoma or cataract, bullous keratopathy, corneal degeneration, dystrophy, mechanical trauma, and eyelid reconstruction and dysfunctional tear syndrome. So it's many of the same kind of indications that ophthalmologists in South Africa are using Amniomatrix to treat. But there are also some indications here where it wasn't so successful, particularly mucous membrane, pemphigoid, which was 79% failure. So we thought that this would be interesting for any users of Amniomatrix to review the data coming out of other centers. Moving on to the second paper, the Rock et al. Paper. This was a study looking at amniomatric membrane transplantation at the University Eye Hospital in Tübingen in Germany over a 16-year period from 2001 to 2016. And in total, they had released 771 amniotic membranes for transplantation. And you can see that the figure on the right-hand side, that there's a steady increase over the years in the number of amniotic membrane transplantations that are performed. And when they just looked at the first 8 years versus the second 8 years, they saw a doubling of transplants from 31 to 66. But if you look at the later years, 2014, 2015, 2016, they're around the 70 to 80 transplants a year. And their findings were that the corneal ulcers and persistent epithelial defects were the most common surgical indications that were treated with the amniotic membrane. So what we wanted to do was to compare this to some of our in-house data. And our database includes all of the dispensing of the amniotic membrane allograft since 2014. In that time, we've dispensed 1,865 Amniomatrix. Again, a very safe product. We've had no issues with any of the product. What we can track is the ICD-10 code that's used on the prescription. And there's been over 40 different ICD-10 codes that have been used. And we've just highlighted some of the top ICD-10 codes on the table on the right. And the 3 top indications, pterygium, corneal ulcer, and disorder of the lacrimal gland, make up over 50% of the use of the product. And then we have a lot of other ICD-10 codes, which many of them overlap. So in summary, I think we're seeing similar results to the European tissue banks, of an increase in the amount of use of Amniomatrix, that it's a very safe product, and that there are certain indications where it's become standard therapy. So the next studies look at the use of amniotic membrane for pterygium treatment and for reduction of pterygium recurrence. And there's 2 studies that have demonstrated that amniotic membrane grafts for pterygium surgery can reduce the recurrence of pterygium. And the second study looks in comparison to conjunctival autografting. So the first study by Rosen was a review of all the studies performed within their clinic. It was a retrospective study of the long-term outcome of pterygium surgery with using amniotic membrane transplants after the pterygium has been excised. And they also used intraoperative mitomycin C. And the operations were performed between October 2010 and June 2016. It included 556 eyes of 535 patients. And the average follow-up period was just over 17 months. They saw corneal recurrence in 20 eyes, which is 3.6%, and conjunctival recurrence in 12 eyes, which is 2.2%. And within the paper, they discussed that this is much lower than they would see using any other procedures. That reoperation was performed on 11 eyes, which was 2%, and something that there's been a few reports in South Africa of granuloma, and so it was interesting to observed that granuloma occurred in 0.5% of the procedures. The second study by Pan et al., entitled Comparison of Hyperdry Amniotic Membrane Transplantation and Conjunctival Autografting for Primary Pterygium, was published in BMC Ophthalmology in 2018. This was more of a clinical trial in a comparison of the dehydrated amnion versus conjunctival autografting. So the study evaluated the safety and effectiveness of hyperdry amniotic membrane transplantation compared with conjunctival autografting for the treatment of primary pterygium. In this study, they looked at 141 eyes from 130 patients with primary pterygium randomized for treatment between the two arms. So firstly, the pterygium was excised, and then it was either followed by amniotic membrane or conjunctival autografting. Their follow-up period was just over 12 months in both treatment groups, and the recurrences occurred in four eyes of the hyperdry amniotic membrane, which was 5.06%, and 13 eyes of the conjunctival autograft group, which was 20.97%. And you can see in the two tables at the bottom, the recurrences for the hyperdry amniotic membrane was 4 out of 79, and for the conjunctival autografting, it was 13 out of 62, which was highly significant. So these two studies indicate that definitely for the prevention of recurrence of pterygium, amniomatrix or amniotic membrane may be the most appropriate treatment. So we're going to change tack a little bit now and look at OptiSerum and some of the recent literature around how umbilical cord serum eye drops can be used. The first publication to discuss is this comprehensive review of umbilical cord serum for ocular diseases, published by Giannacari et al. This year. And this group in Italy have done a lot of work with umbilical cord blood serum eye drops. Many of the studies emanate from this group, but this review is titled Umbilical Cord Blood and Serum for the Treatment of Ocular Diseases, a comprehensive review. And it really is an excellent and comprehensive review. It explores the clinical results that have been obtained using umbilical cord blood derived products in the field of ophthalmology. And in terms of looking at all the clinical trials that are being performed with umbilical cord serum, it's probably the most comprehensive review that I can find. It looks at the 13 clinical trials that have been performed in humans, and this has involved over 620 participants, and approximately half of those have received the umbilical cord serum treatment, with the other half receiving either controls or placebo. These clinical trials were conducting a number of ocular diseases, including persistent epithelial defect, neurotrophic keratitis, dry eye, graft versus host disease, chemical injury, and post-LASIK persistent epithelial defect, as well as Sjogren syndrome. And for any of you that are involved in stem cells, they also have quite a complete section in the review which looks at the animal studies that have been conducted using umbilical cord blood-derived stem cells, which is a big area of research at the moment. But there are currently I'm not aware of any studies in humans where they've progressed to use of stem cells for treatment of these indications. And then the final studies that we want to discuss are the use of umbilical cord serum for the treatment of glaucoma. This was a publication from Campos et al., topical treatment with cord blood serum in glaucoma, a preliminary report, and it was published in Case Reports in Ophthalmologic Medicine in 2018. And this was a case report looking at 2 patients and a retrospective data analysis of 2 glaucoma patients treated with umbilical cord serum eye drops. Case 1 was a 66-year-old male suffering from type 1 diabetes who had been requiring insulin therapy since 2006. And he'd also presented with diabetic retinopathy and primary open-angle glaucoma, which had been diagnosed in January 2014. The values of the IOP were successfully maintained within normal range with hypertensive topical drugs. And in January 2016, the patient had referred because of increasing irritation symptoms of eye discomfort, and they were scored using 2 different scoring methods: the ocular surface disease index, where the patient has scored 65 out of 100, and then with the visual analog score with a score of pain of 74 out of 100. And there was no difference between the 2 eyes. In April 2016, the patient reported no relief from the severe symptoms. And in May 2016, the patient was proposed to receive the topical cord blood serum eye drops as a compassionate unconventional therapy. And the rationale for the therapy was to reduce the pain symptoms for which the previous therapeutic attempts had turned out to be unsuccessful. So it wasn't really to treat the glaucoma, it was to treat the pain associated with the conditions. So administration of the cord blood serum eye drops started in June 2016. The regimen was 8 drops in each eye for a total of 2 months, after which the treatment was stopped. And then in September 2016, the patient reported a significant relief from subjective symptoms of discomfort. The ODI score was reduced to 24 out of 100, and the VAS was reduced to 35 out of 100. Interestingly, when they looked at the IOP and the visual field test, the IOP result was in the normal range, and the visual field test results are shown below. You can see in figures on the top is the right eye, and the 2 on the bottom is the left eye. The first panel is June 2016, and the second panel is in September 2016. So you can see then in the top 2 panels between June and September, there was a marked improvement in the visual field test in both the right eye, and then similarly in the bottom, there was a marked improvement in the visual field test in the left eye. The second patient was a 60-year-old female. She was diagnosed with primary open-angle glaucoma and for 10 years, and this had been treated with hypertensive drugs and regularly controlled IOP twice a year, which appeared maintained within normal ranges. In 2016, in January of 2016, the patient had reported irritating symptoms of eye discomfort, a burning itchiness, and a gritty feeling of sand, mainly in her right eye, and this had persisted over the last 6 months. The situation had been managed with the use of several types of tear substitutes, but none of them had been successful in symptom relief. The symptoms were scored in the right eye with an OSDI of 74 out of 100 and a VAS score of pain of 85 out of 100. But in the left eye, things were defined, or the patient felt that symptoms were acceptable. There, the OSDI score was 22 out of 100, and the VAS score was 21 out of 100. So 2 months later, in March 2016, the patient was proposed to receive only in the right eye a treatment with topical cord blood serum, again as a compassionate unconventional therapy with the aim to reduce the pain symptoms. And they continued the hyaluronic acid-based tear substitutes in the left eye as a control. So in this patient, the cord blood serum eye drops started in April 2016. Again, 8 drops, but only in the right eye. And this was carried on for a total of 2 months, and then it was stopped. In September 2016, the patient reported a significant relief from subjective symptoms of discomfort. In the right eye, the OSDI score was reduced to 28 out of 100, and the VAS was also reduced to 32 out of 100. And in the left eye, there was also a reduction in the OSDI and the VAS to 16 out of 100 and 15 out of 100. And then in September of 2016, they performed the IOP and the visual field test. And underneath the figures here, you can see figures A is the right eye in March 2016, before the start of the cord blood serum. In the middle panel, C is the right eye in June 2016, after the drops had been finished. They terminated the treatment. And then E on the right hand side is the right eye after 4 months. So in September 2016, well after the umbilical cord serum drops had been terminated. And so you can see that on the top 3 panels that there was a very marked improvement in the visual field test with the cord blood serum treatment, and that this persisted once the treatment was discontinued. Interestingly, they also saw an improvement in the left eye, and this was the eye in which they continued with the hyaluronic acid drops. And the authors suggest that the improvement here is evidence of neural crosstalk mechanism between the 2 eyes, and that it's a result of the umbilical cord serum treatment, but they have no data to prove that. So I'd like to finish there. Very brief, but we really wanted to just substitute the newsletter that we've circulated and explain why we feel that these particular publications would be of interest to all of our amniotic membrane and umbilical cord serum eye drop users. And I'd be very happy to take any questions that you have. So the first question I've got here is, what is the difference between the dehydrated amniotic membrane and the cryopreserved amniotic membrane? So the cryopreserved is just frozen. So we take the amniotic membrane, we incubate in antibiotics, and then pretty much freeze it straight after that. So it still has potentially a lot of the growth factors and cells even that are on the membrane, although many of the cells will be lost during the freeze thawing process. The dehydrated amniotic membrane is much more heavily processed, so it's also incubated in antibiotics. Then all of the cells and tissue is denuded from the amnion, leaving just really the the secondary structure and the collagen matrix there. That is then dehydrated and packaged, and then following that, it is gamma irradiated, so sterilized with gamma irradiation to make sure that it's a very sterile and safe product. Okay, sorry, there's another question here. So the question is, in the final paper, was the concentration of the cord blood serum eye drops the same as those supplied by Placelta? The concentration in terms of the dilution was the same. We use a 20% dilution of the cord blood serum, although there will be obviously individual differences between the donors, and in the paper they went into some detail at looking at various growth factors within the serum, and so we haven't compared the exact levels of growth factors in each batch of our OptiSerum to those in that paper, but we have seen comparable levels of many of the growth factors when we've used other methods to look at our OptiSerum. Okay, there's a question here. Sorry, I'm just trying to expand the view. So the question is, why would cord blood serum topically improve visual fields in glaucoma? In the final paper, was the concentration, no, sorry. So regarding the why would the cord blood serum improve the visual fields in glaucoma? So the theory hypothesis proposed by the authors of the paper was around the growth factors that are present in the cord blood serum and the effect that they have on the various nervous factors influencing the glaucoma. So although the drops are applied topically, obviously it will be absorbed into the tissue and can have then a more central effect. Okay, I'm not seeing any more questions. Okay, it looks like there are no more questions. So I'd like to thank everybody for attending, and please, you're welcome to contact me if you have any further questions around our amniomatrix or umbilical cord serum eye drops, OptiSerum, and we'll be happy to if we don't know the answers, we'll be happy to try and find out the answers for you. Thank you very much, everyone.